Greetings, fellow orthodontists. It was a pleasure meeting you all the other night. One of the questions that were not addressed was how to transition from one set of aligners to the next, or in between additional aligners or refinements. And this is just one of the strategies that can be used. You will notice here on one of my comments, please add four upper and lower passive aligners, followed by one stage of virtual power chain. So the technicians pretty much understand these days that you're trying to get four passive aligners, and because the software does not allow that, they will built in minimal movement on one arch, and in this case they built in minimal movement on the upper arch. They gave me four passive aligners and a virtual power chain. And by the way, I'm gonna use also this to show a nifty little tool that I use a lot, which is the superimposition. So oftentimes with adults, they come in asking, oh, what is happening now? I am not seeing enough movement, particularly on cases where you might be doing sequential distalization before you get movement of the anterior teeth, and the patients start to get a little impatient about not seeing the front teeth moving. I use this a lot to show where the movement is happening. So basically what this does is you can use the top handle here to move the patient to the stage that they're currently wearing. So let's say they've progressed to stage 12. And so in the bottom handle is the superimposition, and it will show you where the teeth were on stage 0 and how they have been moving towards the stage that we are now, 12. And once you pass that point, it will indicate the stages or the direction that the teeth are moving next. So it gives you a really good way to discuss progress with patients and show, here's where you were in blue, the white is where you are now on stage 12, and going forward, this is where we're going. So this can be very helpful in many scenarios. But going back to our transition stage there, so let's just move this patient all the way to stage 20. That's where we start the lower passive aligners, and I'll just use the superimposition here. And unless you have the superimposition tool on, it's very hard to see where the movement may be happening. So I'm going to turn off the superimposition tool, and if you just toggle here, you're going to have a feeling that we have passive aligners on both arches, when in reality there is some movement on the upper arch, and it will typically be a movement that is of clinical insignificance. So if I put in my superimposition tool, and I've already looked at this and I found where the movement is, but you will notice here, let me just zoom in a little, and I'm going to hold the shift key on my keyboard so I can center, and let's watch what happens here. This is where the movement is happening. So there is a slight intrusion of the second molar, extrusion, I would say, which is really clinically insignificant. So this bottom handle here is not the lower arch. This is where the tooth is going after this stage. So there you have the use of the superimposition tool, but that was just an additional tip here. Holding the control shift to position your model and be able to zoom in. And if we look at the lower arch, there is really no movement on the lower arch, no areas of superimposition change. And then when we get to the very last stage, we have, so let me turn off, we have a virtual power chain. So it's not my intention to use the virtual power chain. My intention is to schedule the patient on stage 20. So if we had to remove attachments or rescan, I would schedule it here on stage 20 and just let the patient go with 4 more trays. And in 4 weeks, I would have the refinement aligners back, so the patient would continue to to change their aligners, and that has a tremendous positive impact on the flow of treatment. You wouldn't have to stop or run the risk of having trays not fitting. I use this a lot with teenager patients to stabilize the occlusion if their teeth erupting. So there's all sorts of good applications for this strategy. So there you have it. I hope that answers that question. I'll talk to you guys soon. Thank you.